The studies that World Vision and other agencies are conducting are based on barrier analysis, which is a rapid assessment formative research tool to identify the behavioral determinants associated with a particular behavior, such as mask use or vaccine acceptance. We do these studies in order to develop more effective behavior change messages and activities. BA is based on the health belief model and the theory of reasoned action models. And a key feature of that is that you interview those doing a behavior, the doers, or intending to do a behavior, and compare their responses to those who are not, the non-doers. This allows you to look for correlations between responses and the behavior, and in this case, vaccine acceptance, so you can better identify what is driving behavioral adoption. BA has been used in more than 1/3 of lower and middle income countries. Analysis is done with a simple spreadsheet, and BA was used extensively during the Ebola outbreak, and World Vision is now using it to study acceptance of COVID-19 vaccines, comparing responses from people that plan to get a COVID-19 vaccine with those who do not. I don't have time to give a lot more details on the methodology, but there are online presentations, but feel free to reach out to us as well. These are the main determinants that are explored in these studies. Things like perceived social norms, whether you think that people important to you approve of the behavior, but also things like perceived severity, whether you think that COVID-19 is a dangerous disease or not. We feel that using barrier analysis gives practitioners a much better idea of what they need to be focusing on in terms of messages and activities to promote a behavior, especially when compared to just CAP studies or focus groups. For example, here's an example of some beliefs on acceptance of COVID-19 vaccines in Bangladesh, which we completed in December 2020. This isn't barrier analysis data, but looking at this, what would you focus on if you only had this data on prevalence of beliefs, or if you heard these responses in a focus group discussion? Well, maybe you should work on those perceptions about negative side effects. A lot of people brought those up when we asked what would be a disadvantage of getting a COVID-19 vaccine. Or maybe you could promote more advantages of getting the vaccine other than just saying that it protects you from COVID. For example, talking about how children will be able to return to school once enough people are vaccinated, and that people will be able to return to a normal life. Those seem to be on a lot of people's minds, and it sounds like there's some powerful motivators there. And maybe you would not work as much on talking about not getting COVID-19 vaccine as an advantage of the vaccine, since more than 3/4 of people already believe that, or focusing on social norms, since more than 2/3 of people already believe that most of their family and friends will get the vaccine. Or maybe you have another favorite determinant to focus on. However, of those 3 checked in green, none were found to be associated with accepting the vaccine. They're most likely not driving the acceptance of vaccines. And of those that we rejected with the red X, not getting COVID-19 was an important driver, and believing that most of my close family and friends will get the vaccines was also highly associated with being an acceptor, that is, an intended doer. Instead, here are the things that are most highly associated with intending to get a COVID-19 vaccine in Bangladesh. All of these are statistically significant associations. For example, social norms. Respondents who believe that most close family and friends will get the vaccine were much more likely to say that they would get a vaccine. Respondents who said that most of their community and religious leaders wanted them to get a vaccine were also much more likely to seek the vaccine, as well as those who believed most people in general will get it. Believing that not getting COVID-19 is an advantage of the vaccine was also a very important driver. Look at perceived risk. This was also important. Non-acceptors were 6.8 times more likely to say that they were not concerned at all about getting COVID-19. Perceived access was important, as one would expect. Acceptors were 4.8 times more likely to say that they expected the vaccine to be offered within 30 minutes of their home. This is why we want to use barrier analysis more for other COVID-19 behaviors, And we believe other agencies should be using this tool in addition to other tools like focus groups and key informant interviews and KPC surveys to make decisions around social and behavioral change for vaccine acceptance. Many INGOs are already using behavior analysis, and the tabulation and analysis can be done using a simple spreadsheet, which we have available. So this is an easy tool for people to use.